I'm Trey Perkins. I am the current 2020-2021 Sports Medicine Fellow. So I got to work really closely with all of the sports medicine doctors. I came to know them really well, which I think is one of the biggest aspects of this fellowship.
My name is Dr. Jason Deck. I'm the Program Director for the Primary Care Sports Medicine Fellowship here at OU Tulsa. I am a Tulsan born and raised. I grew up here, went to high school here, did my medical school at the University of Oklahoma in Oklahoma City, and did my residency in family medicine down there. And then I did my fellowship here at the OU Tulsa program. So the thing that brought me back to Tulsa to do my fellowship was that this was a really compact fellowship. We cover two Division I schools that are about 8 or 9 miles apart, and everything else that happens in the fellowship happens between those two schools, which really meant I spent more time with my patients and more time doing sports medicine.
We're very proud of the fact that we have a sports medicine fellowship that's one of the oldest fellowships in the country. I was brought into the department by our chairman at the time to really grow and develop that program, not only to just go and do a sports fellowship, but they want that ability to interact with all of the teams that we take care of in the community. They like the fact that we get to take care of different high schools and different colleges and even professional teams.
One of the other attractive things about our program is that, to my knowledge, this is the only program in the country that the fellow gets to travel with the football team to all of their away games, which really creates a different experience. A lot of times we let the fellow do the main contact with the athletes. Sometimes the fellow is the only physician on campus. Actually, a lot of times the fellow is the only physician on campus, and if they have a question, we're always available to them. For the bigger sports like football, there's usually an orthopedic surgeon on the sideline too. But for some of the other sports like soccer and basketball, a lot of times our fellow is the first and only contact for those athletes unless he needs to take it up to the next level. All of the athletic trainers at both universities that we cover will contact the fellow first before they contact any of the attendees for any questions or concerns they have about their athletes.
So we have that very close-knit dynamic that makes it easier and I think better for the fellow to get to know the athletes really well, the trainers, with each of the sports that we do treat. One of the other things is the amount and the diversity that we get to see as a fellow. So we cover all sports, football, baseball, basketball, soccer, and then there's different tiers. So the majority would be Division I, so TU and ORU. So if you're looking for a wide range of athletics to cover, and you're not really sure of what you want to do in the future, this is one way to hone in on every single little aspect of the sports to know little niche parts that you could be treating.
In the fall, when the TU football team is having their fall camps, this fellow is spending a lot of their time at the fall camps with them because that's most of the morning, every morning that they're doing that. As far as being in clinic, our fellows spend time both in primary care clinic with us at the OU Primary Care Sports Medicine Clinic. They also spend time with Advanced Orthopedics, which is our orthopedic partner here in town. We have 2 orthopedic sports medicine surgeons there that the fellows work with. Also spend time with me. We have a dedicated afternoon once a week to practice ultrasound training. We have a weekly didactic session, and so usually that involves discussing a couple of journal articles. This year it's been on Zoom. It's actually worked out fairly well to work that way. It doesn't feel as much like work as a residency does. You're doing what you want to do. You're covering sports. And so there are a lot of hours. We're covering probably at least two to three nights a week covering some sort of sporting event at one of our schools. But you're there and you're enjoying the sports, and if they happen to need a physician, then that's what you're there for.
So I always knew that I wanted to do sports medicine. So I grew up playing all sports, but my main, love you could say was soccer. So I played all throughout growing up and in college, and giving back to something that made me basically who I am just really spoke to me.